Question number 126. Which toxin acts through adenylate cyclase activity? Answer is B. Vibrio cholera. Vibrio cholera. Now let's discuss a little bit about Vibrio cholera. Vibrio cholera may cause a massive secretory diarrhea without altering the intestinal mucosa. So first important point, that Vibrio cholera can cause massive secretory diarrhea without affecting or altering intestinal mucosa. It releases an enterotoxin. Vibrio cholera releases an enterotoxin that binds to and activates mucosal cyclic AMP which activates chloride channels in mucosal crypts and also by releasing a ZOT. ZOT means zonula occludens toxin, which increases intestinal permeability, This Vibrio cholera consists of Vibrio cholera toxin consists of 1A and 5B subunits. This A subunit, so this is an important, it has 2 subunit, means total it has 6 subunits. Only one is A and it has 5B subunits. The A subunit is dissociated into A1 and A2 fragment. This A2 fragment links biologically active A1 to B subunit. And as I told you earlier, it has also the B subunit. The B subunit unites to GM1 gangliosides receptors which are present on the surface of jejunal epithelial cells. Right? Question number 127. Increased anion gap is seen in all except. So increased anion gap can be seen in all except A, that is fistula. So causes of increased anion gap includes, first of all, normal anion gap is 3 to 11 milliequal per liter. Causes include methanol, uremia, diabetic ketoacidosis, para-aldehyde, drugs like INH, then lactic acidosis, these are some of the causes of increased anion gap. A decreased anion gap is seen when there is loss of bicarbonates, such that diarrhea, then in patients who are recovering from diabetic ketoacidosis, so recovery of diabetic ketoacidosis, fluid loss in an ileostomy, fluid loss, renal tubular acidosis, then with some drugs like acetazolamide, so these are the causes of decreased anion gap. Question number 128. All drugs causes elevated plasma prolactin except. So here the answer will be D, that is digoxin. Question number 129. Blastic crisis leads to, answer is B, hypophosphatemia. There is a rapid cellular proliferation in blast crisis. Rapid cellular proliferation in blast crisis will lead to consumption of phosphate and thereby leading to shift of extracellular phosphate in cells. So patient will have hypophosphatemia. Question number 130. Most common cause of Kahn syndrome. Among the options we have answer A, cortical adenoma. So let's discuss about aldosteronism. Aldosteronism, there is excess secretion of aldosterone and this can be seen in due to primary pathology of adrenal gland, primary pathology of adrenal gland, then is due to reduced plasma volume, and increased angiotensin production, and due to increased angiotensin production, or patient can have secondary aldosteronism due to cirrhosis, nephrotic syndrome, or cardiac failure. Kahn syndrome is basically Kahn syndrome is primary hyperaldosteronism is primary aldosteronism, and it is due to first aldosterone producing adrenal cortical adenoma, most common, adrenal cortical adenoma, bilateral idiopathic adrenal hyperplasia, then is aldosterone secreting carcinomas, aldosterone secreting carcinomas. Question number 131. In which of the following diseases primary skin lesions are not seen? And the options over here are question number 131. Answer is C, that is hepatitis B. Now in SLE, skin rashes are more common, are also seen. By the name Meller rash we can see, discoid rash, petechiae we can see, and SLE is an autoimmune disease and there is an autoimmune thrombocytopenia. Leptospirosis, yes, we see skin rashes are seen, and infectious mononucleosis we see the skin rashes also. Question number 132. Gold standard investigation for diagnosis of insulinoma is 72-hour fasting test. Answer is B, that is 72 hours fasting test. So basically insulinoma is associated with elevated plasma insulin more than 30 parts mole per liter and increased C peptide levels more than 300 parts mole per liter. Here, my dear friends, in insulinoma, gold standard remains 72 hours fasting test. Gold standard test for insulinoma is gold standard test for insulinoma contains 72 hours fasting test. Question number 133. A child underwent tonsillectomy at 6 years of age with no complications. He underwent a pre-operative screening for bleeding at the age of 12 years before an elective laparotomy and was found to have a prolonged partial thromboplastin time but normal PT and thrombin time. There was no family history of bleeding. The patient is likely to have. Okay. So here the answer will be C, factor 12 deficiency. Now let's discuss why is it so. First of all, there is an isolated increase or prolongation of PTT which suggests of a defect in the intrinsic pathway of coagulation cascade and leaves us with a possibility of, and there is a possibility of either factor 12 deficiency or hemophilia A. That is factor deficiency. Now in the question there is absence of bleeding even after a major surgery like tonsillectomy, which is suggestive of deficiency contact of factor 12. Important points to be remember over here, my dear friends, are if you encounter a question which says that there is isolated elongation of a PTT with bleeding manifestations, then the answers will be either the patient is having factor 8 defect, factor 9 defect, factor 11 defect. If there is isolated prolongation of PTT without bleeding manifestation. Patient can have factor 12 deficiency defect, or patient can have pre-Kallikrein defect. Question number 134. False word factitious thyrotoxicosis is option number C, radioactive iodine uptake is high. Let's discuss about some important points about factitious thyrotoxicosis. First, it is seen in nurses. Excess thyroxine, history of excess thyroxine to lose weight patient develops features of thyrotoxicosis, features of thyrotoxicosis. Radioactive iodine uptake is low. Question number 135. All of the following enhances insulin sensitivity except, answer is C, tumor necrosing factor alpha. Let's discuss some of the effects on insulin resistance. Leptin, it decreases insulin. TNF alpha, it increases. Then adipopectic, it also decreases. Then thiazole deoxynase, they also reduces insulin resistance. Post-exposure prophylaxis of HIV is question number 136. Answer is A, that is raltegravir. tigavir plus emtricitabine plus tenofovir Question number 137. Adrenal reserve is best tested by the means of infusion of. Answer is D, that is ACTH, ACTS. The function reserve of adrenal gland is tested by administration of ACTH. If the reserves are adequate, the control level increases in adrenal venous blood. Then question number 138. Question number 138. About beta thalassemia measure true is commonly presents with neonatal jaundice, is associated with atrophy of the spleen, should be treated with regular oral desferoxamine to reduce iron overload. None of the above. Answer is D, none of the above. None of the above. Let's discuss a little bit about beta thalassemia. Beta thalassemia major presents within first year of life after the switch to hemoglobin A as production of the latter is severely impaired. Because owing to there is normal production of embryonic and fetal hemoglobin, embryonic and fetal hemoglobin, the diagnosis cannot be made antenatally on fetal red cell electrophoresis, but it requires family DNA studies. Requires family DNA studies. Question number 139. All of the following is associated there is a printing mistake. Question number 139. Answer is D. Burkitt's lymphoma. What is Burkitt's lymphoma? Burkitt's lymphoma is a cancer of lymphatic system in particular B lymphocytes. Let's discuss about the types of Burkitt's lymphoma. Types of Burkitt's lymphoma. There are basically three types: endemic, other is sporadic, third is AIDS associated. This occurs in age between 8 to 15 years. This also occurs between the age 8 to 15 years. This mainly affects young adults. Site. This is most commonly seen in face, abdomen, CNS, lymph node. This is also seen in abdomen, face, and this is seen in lymph nodes, mainly seen in lymph nodes. Question number 140. Drug of choice in type 1 lepra reaction with severe neuritis is, answer is A. Systemic steroid. Systemic steroids. This type 1 lepra reaction is best treated with glucocorticoids like prednisolone with 40 to 60 milligram per day. As there is an acute inflammation, so the glucocorticoids will help in reducing the acute inflammation. Thalidomide is also not that much effective, it is ineffective against type 1 lepra reaction. So question number 141. Romana sign is seen in question number 141. Romana sign is seen in Trypanoma cruzi. B. Trypanosoma cruzi. Now Romana sign is the classical finding in acute Chagas disease. It consists of painless unilateral painless edema of pelvibrae and periocular tissues. Question number 142. False regarding anemia of chronic disease. So the option will be B, decrease ferritin. Let's discuss about anemia of chronic disease is characterized by a block in delivery of iron from the reticuloendothelial system to the erythroid progenitors. Consequently, patients have normal to increased iron stores in the marrow and a normal or increased ferritin levels. There is a block, because there is a block in delivery, serum iron levels fall, and so does the total iron binding capacity and transferrin saturation. If there is low serum iron and an increased total iron binding capacity, it's seen in iron deficiency anemia. If there is low serum iron with the decreased TIBC, it's anemia of chronic disease. Anemia of chronic disease. Question number 143. Which is not true about Legionnaires' pneumonia which is not true about Legionnaires' pneumonia. So here the answer will be question number 143. A, that is erythromycin is the drug of choice. Why so? Because here we can recommend azithromycin, clarithromycin, clarithromycin, or fluoroquinolone, These are the drug of choice for treatment of Legionnaires. Why these drugs are given? Because they have good intracellular penetration, and they have in vitro activity. Question number 144. The following diseases are accepted with Epstein-Barr virus, except options will be okay. Question 144. Answer will be V. Epidermodysplasia virigiformis. Epidermodysplasia virigiformis. Epstein-Barr virus is associated with infectious mononucleosis, oral hairy leukoplakia, Third is nasopharyngeal carcinoma. Nasopharyngeal carcinoma. Whereas papillomavirus is associated with common warts, associated with common warts, plantar warts, verruca plana, anogenital warts, CA cervix, A 40-year-old male complains of weakness, weight loss, and abdominal pain. On examination, the patient has diffuse hyperpigmentation and a palpable liver edge. Polyarthritis of the wrist and hip is also found. Fasting blood sugar is 185. The most likely diagnosis is, okay, so the answer will be over here, D, hemochromatosis. Hemochromatosis. Hemochromatosis is a disorder of iron storage that results in deposition of iron in parenchymal cells. The liver is usually enlarged and excessive skin pigmentation is seen. Pigmentation is present in symptomatic patients at the time of diagnosis. Diabetes occurs secondary to direct damage to the pancreas by iron deposition. Enteropathy also develops, arthropathy develops in 25 to 50% of cases. There is a presence of Addison's disease which can cause weight loss. So we had option number C, Addison's disease. In Addison's disease, patient have weight loss and hyperpigmentation, but it does not affect liver or joints. It is associated with hypoglycemia, rather than diabetes. Rather than diabetes mellitus. Question number 146. Lesker sign is seen in A. DVT. Lesker sign is tenderness, when the front middle anterior medial part of the tibia is tapped, means when we do the percussion, so basically we see there is a tenderness. This basically develops in patient who are having blood clots in their legs, mean the patient is having deep vein thrombosis. Question number 147. A 60 years old man who developed atypical pneumonia. Which of the following statement regarding pneumonia is correct? Okay, so question number 147 and the answer will be A. Urine test for Legionella antigen is 90% sensitive. Urine test for Legionella antigen is 90% sensitive. Star mark. The sensitivity and specificity of the Legionella urine antigen test is as high as 90% and 99% specificity respectively. Question number 148. Which of the following red cell distribution width is normal in? Answer is C. RDW. Question number 148. Answer is C, that is megaloblastic anemia. Megaloblastic anemia. Now what is RDW? Red cell distribution width. Is the coefficient of variation of RBC volume. So it reflects variability of red cell size. Its normal value is 11.5 to 14.5 units. It permits discrimination between iron deficiency anemia and other microcytic anemia. Increased RDW are found in hemolytic anemia. Question number 149. Volcano ulcers in esophagus are seen in. Volcano ulcers are seen in herpetic esophagitis. That is A, herpetic esophagitis. The ulcers of herpes esophagitis can have a punctate, linear, stellate or volcano-like appearance. Often with the thin halo of edema at the margins. The ulcers may be clustered together widely separated with normal intervening mucosa. Most common cause of infectious esophagitis is Candida esophagitis. Question number 150. A 41 years old patient complains of frequent episodes of bloody diarrhea and mucus for 5 years. Despite regular treatment with adequate doses of sulfasalazine, he has repeated exacerbation of his disease and required severe weeks of steroids for the control of flares. What should be the next line of treatment for him? So it looks like the patient is having ulcerative colitis or Crohn's disease. In both the stages, we would like to give for as a thiopurine as the next line of treatment, my dear friends. So maintenance therapy with sulfasalazine was not able to maintain the remissions as per the questions, and he requires corticosteroids for the control of his exacerbation. Patient is now in a remission stage, and a drug which can maintain him from a remission is required. In this cases, azathioprine reduces the requirement of the steroid. So the answer will be 150. Answer will be B, azathioprine. So what is the management protocol? Let's discuss. Management protocol for both ulcerative colitis and Crohn's disease. First is 5-aminosalicylic acid. 5-aminosalicylic acid is used in both the cases. If the patient is having, if it is not controlled, means patient is having uncontrolled disease, then patient or the patient is having exacerbation, give glucocorticoids. These glucocorticoids are effective in inducing remissions in both Crohn's disease and ulcerative colitis. These glucocorticoids play no role in maintenance therapy in either ulcerative colitis and Crohn's disease. Once clinical remission has achieved, they should be tapered and then again maintenance therapy should be started, like azathioprine, and 6 mercaptopurine.